Hi, this is Lisa. I'm going to be doing a podcast, a series of 4 for you on medical terminology. Medical terminology is a way to communicate within the healthcare providers that when it's written or typed, that it's a shorthand, but everybody will be able to understand it. And the example I always like to use to compare it to is text abbreviations. So when you text out things, you don't want to write the whole thing like laugh out loud or I know, right? So if you think of medical terminology as a way to be able to communicate to everybody what you mean and that everybody will understand it, but not having to type or write a lot of words. And like I said, it allows everyone to communicate in one language. Way back when, before Joint Commission really put medical terminology as a forefront in one of its patient safety goals, every institution would have its own way, abbreviations and medical terminology, and Joint Commission has really helped standardize. So the abbreviations, the terminology mean the same thing no matter what institute you're in. The medical terminology will be divided into 4 units. The first one, this one will be abbreviations. Then you'll have root words, suffixes, and prefixes. And this will be a way that you can look at words and you might not know exactly what it means, but you can get a pretty close estimate of what it means by looking at either the root word, the suffix, or the prefix. And this will apply to medication. You'll come to learn that later too. So outcomes, you're going to have to watch this podcast or listen to it. I have put in Quizlet study guides, so I've put the terminology that is in all the podcast, and you can use them as flashcards, you can play games, you can do whatever you want, but you need to review those and study it for Quizlet. And then there will be a quiz in Canvas that you will have to complete for each medical terminology. It's important that you understand the medical terminology, that you understand how to look at words and break them apart and determine what they mean. So we do feel this is important, and that's why we want you to do this. Abbreviations. There are many, many, many abbreviations in medical terminology. Almost all of them are based on Latin. What I will say, this is one of those ones, this is kind of the exception in nursing in that you have to just memorize these. And that's why I made the Quizlet apps, the Quizlet flashcards. It's just the more you use them, the more you practice with them, the better it will become. And you can use this in your clinical setting, in your simulation setting, but it's just a memorization. Most of the abbreviations are standardized. Some institutions do have many of their own abbreviations. We are going to be teaching you the ones that Joint Commission have recommended. You will be hearing a lot about Joint Commission throughout your entire nursing career. And they also have a list of what's unacceptable, which will be at the end of this podcast. And it is important to know which abbreviations are acceptable and which ones are not acceptable, because you don't want to be using things that are not acceptable in your documentation. So we're going to go ahead and get started. The first ones that I want you to memorize or work on refers to times or frequency. So we have BID, TID, QID, PRN, and STAT. BID is twice a day, TID 3 times a day, QID 4 times a day, PRN as needed. That means they don't necessarily get it scheduled, but if they need it, and will be certain time parameters on it. And STAT immediately within an hour. These are important. A lot of our medications will have these abbreviations on them, and a lot of the physician or nurse practitioner orders will also have, like ambulate the patient, QID. Get patient up to chair, BID. So it is important that you know these. Vital signs. Vital signs are where we're taking the patient's pulse, respirations, temperature, blood pressure, oxygen, saturation. So you can see we have VS for vital signs, BP, blood pressure, P, pulse, R, respirations, T, temperature. SaO2 is your oxygen saturation or your pulse ox. And then depending on your institution, some hospitals will use Celsius and some will use Fahrenheit, and you can see it's C or F. Used to be, I think RR was respirations, but Joint Commission recommends that it be R for respirations. So these again could appear in orders. It can appear on worksheets, but it's important to understand what these abbreviations are. So I'm going to ask you, what does this sentence say? VSQID to include TP, BP, but not R. So think about that one. You can go back to the previous screen. T to be taken PRN for signs of fever. And then I want you to pause this, and I want you to write the following using abbreviations for the underlined words. Oh, I forgot to underline them. So vital signs 3 times a day. Take oxygen saturation with the vital signs. I forgot to underline, but you want to do vital signs 3 times a day, oxygen saturation, and vital signs again. Document the temperature in Fahrenheit. So temperature, Fahrenheit. Body system. So here's some abbreviations that refer to the body system in general. ABD is for abdomen, GI, gastrointestinal, GU, genital urinary. Those are pretty self-explanatory. Activity abbreviations. So these are things that are going to describe what activities we're going to have the patient do. So AMB, ambulatory, the patient can get up and walk about. BRP, bathroom privileges. That means the patient can get up to go to the bathroom, but that's it. OOB is out of bed, so the patient can get up out of bed. Up ad lib. That means the patient can walk without assistance. They can get up out of bed, they can walk in the halls, they can walk wherever they want. HOB is head of bed, and ROM is range of motion, and that's where we have the patients move their arms and their legs, especially if they're in bed rest, to keep them from getting contractures. Documentation. DX is diagnosis, so that's the disease or the problem the patient has. HO is history of, so the patient has a history of diabetes mellitus. The patient has a history of cardiac failure. NKA is no known allergies. PMH is past medical history, so that's what the medical problems the patient has had before they come to your care. R/O is rule out, so that means somebody's coming in with abdominal pain, rule out appendicitis. We're coming in with a problem and we think it's being caused by another problem and we want to rule that problem out. SX is symptoms, so that could be signs and symptoms. So if the patient's coming in with abdominal pain, their symptom is pain. DNR is do not resuscitate. This is a code status, so if the patient would stop breathing or their heart would stop beating, we would not do CPR or anything to revive them. And HX is history. Some more is HA is headache, NV, nausea and vomiting, so the patient's going to throw up. SOB is shortness of breath, and HTN is hypertension or high blood pressure. Here's some to do with nutrition. NPO is nothing by mouth. The Latin is nothing per os. Os is mouth. INO is intake and output. This is how much the patient is consuming or taking into their body and how much they're putting out. So IV fluids, anything they drink, eat, any urine output, stool output, emesis, bleeding, things like that. IV is intravenous. That means we'll be administering something through the veins. KVO is keep vein open. This refers to IV fluids. We'll run just enough fluids through the IV to keep the vein from collapsing and clotting, but keep the IV from clotting off. So usually KVO is about 30 mils an hour, which will probably not make any sense right now, but it will, I promise. And TF is tube feeding. That's where we're giving the patient nutrition through their stomach, through a tube in their stomach. BX is biopsy. That means we're taking a specimen or a sample. ABG is arterial blood gases. This is what we do to check a patient's respiratory status. Culture and sensitivity. This is where we're getting a specimen. It could be blood, it could be urine, it could be sputum, and we're going to culture it and see what it's sensitive to or what antibiotics we can use to fight it. Chest X-ray is CXR. EKG is the cardiogram, electronic cardiogram, and that's where they put the electrodes on the body and they get a tracing of the electrical output. And UA is urinalysis, and that's where we'll get a urine specimen. Upper GI is UGI. This is a test we do to see if there's obstructions or anything wrong in the intestines. And then we have some blood work. CBC is complete blood count. This is a test we'll do. You'll learn more about it, but where we look at the white blood cells, red blood cells, and platelets. RBCs is just the red blood cells. WBCs is the white blood cells. RBCs and WBCs are part of a CBC. Post-op or post-operative means the patient has had surgery, so it's after surgery. Pre-op is before surgery. Here are some more disease processes. CA is cancer, so you'll say CA of lung, CA of colon. CAD is coronary artery disease, so that's where there's a disease, there's blockage in the coronary arteries. COPD, chronic obstructive pulmonary disease. CVA is cerebral vascular accident, commonly referred to as a stroke. DM is diabetes mellitus, or diabetes. MI is myocardial infarction, or a heart attack. And URI is upper respiratory syndrome. So this is where they're having like sinus infection or something like that. Usually the A is a little a with a line over it. That means before. So give insulin a breakfast AM meal. Up ad lib, I think we did already, but it's up as desired. AMA is against medical advice. That's where the patient is doing something the doctor has not recommended. BM is a bowel movement. C means with. DSG is dressing, so they could have an abdominal dressing, IV dressing, central line dressing, but DSG. And FX is a fracture, so that usually means a broken bone. NG is nasogastric, and that's a tube we take and we insert it in through the nose and down into the stomach. You'll learn about that in 104. P is after, so MPO, P, midnight. Patients not to have anything to eat or drink after midnight. S is without, so you don't want to do that or give patients something. Status post, so S/P, status post, that's after something. So you can say patient is status post appendectomy, which means they've had their appendectomy. Status post amputation. And then X is times, so it might be like BID times 4. BID X 4. And here's a list of the do not use. This is from Joint Commission, so you don't want to use, we have what we refer to as unit or units, and we used to use U. And it's hard to tell on the typewritten, but it can be mistaken for 0 or the number 4 or CC. You want to write the word unit. IU is international units. That can be mistaken for the or for IV, intravenous, or the number 10. And then we used to use QD in multiple ways. QOD. QD was every day. QOD was every other day. And sometimes it's hard to tell. It could be mistaken. The Q can be mistaken for an I and the O for an I. It just wasn't very clear. I dropped my speaker. So you want to write daily or every other day. And then this one will be important, especially with your med math, is you don't want to have a trailing 0. So if you have the answer is a whole number and like you get 15.0, you just want to put 15 because sometimes a decimal point can be missed and people will think it'd be 150. And you always want to have a 0 in front of a decimal point. So you would write 0.x because sometimes a decimal point could be missed. So you would be thinking it would be 5 milligrams, 0.5 milligrams, but if you don't have that 0, it could look like 5 milligrams. You can't see it on the screen. Let's see if I can get this to roll up. Oh. You don't want to write, we used to write MS. Oh, that's what I wanted. For morphine, or it could be magnesium sulfate. And we also don't want to write MSO4 or MgSO4. You want to write morphine sulfate or magnesium sulfate. I will say it is easier now if you're working in an institution that has electronic charting, because typing, it's easier to read. Handwritten could be a problem. And there are more unacceptable abbreviations, unapproved abbreviations in your SurePath in one of your units, so you want to look at that. But this concludes abbreviations. Like I said, this is one you're just going to have to memorize the abbreviations. Go to the Quizlet, practice writing different things when you're in lecture and lab. And if you have any questions, let me know. Thank you.